What makes great CV for an applicant?
When I review the ERAS CVs, I like to see that it's well rounded. That is okay. That I like to see that they have work experiences, they have some research experience, they have some volunteer experience, they have, if possible, some med school awards and other awards accomplishments, so trying to fill that as best as you can. Now, the CV still has to be brief. It has to be to the point. I really would not like people to writing very lengthy descriptions, because program directors have very little time to review your application and make a decision. Should I call this person for interview or not? There's been lately a lot of focus on hobbies. There's this question on what are your hobbies and interests. It's because, once a program director gets an application, almost all the applicants have very good scores, have maybe, US clinical experience. So it's these other things like the hobbies that, separates you from other applicants. It's your personal statement and your experiences that separates you out from the others. So do not ignore the hobbies. There was one applicant, who was asking me, I don't have a hobby. What do I do? And I would say, okay, then think of something that you can, if you're into, for example, yoga, do the 200 hours, become a yoga teacher, and, that's going to be your hobby. So, things can still be built. It's not something that you have done since childhood, but do make sure you have some interesting hobbies to share with the selection committee.